What's up, everybody? Dr. Rossi, shrinksandsneakers.com. I get a lot of comments that go something like this. All psychiatrists do is prescribe medication. So naturally, when I start talking about things like nutritional psychiatry, lifestyle modification, or the value of psychotherapy, people are shocked. And I've made the choice to consciously cover a lot of information regarding medication because there's a significant amount of confusion surrounding psychiatric medications. There's also a lot of misinformation, people not really understanding these medications very well. And there's also a general benefit to patients knowing more about the medications they routinely use. So while medication management is a substantial portion of what most psychiatrists do, it's not the only things we're capable of doing, and it's not the only things we do on a regular basis in clinical practice. So let's go through 5 things that psychiatrists do other than prescribe medication. So what are the 5 things that psychiatrists do other than prescribe medications? So the first one that comes to mind for me, and one that I feel is extremely valuable and underutilized by most psychiatrists just because of the restrictions most of us have in the type of practice that we do, and that is psychotherapy. So most psychiatrists are trained in at least one form of psychotherapy. So they get pretty proficient in at least one type of psychotherapy. So that could be cognitive behavioral therapy, that could be interpersonal therapy, that could be motivational interviewing, and in some cases, some psychiatrists choose to go on to do what's called psychoanalytic training. So thinking back to Freud and all of that stuff, you can do a 5-year program that's quite intensive and even has a requirement of being in psychoanalysis yourself as a patient, because you learn quite a bit from assuming that patient role and putting yourself into that perspective. So psychotherapy is certainly one thing that most psychiatrists are doing on a regular basis other than prescribing medication. The next thing that comes to mind for me in regular routine clinical practice is procedure-based psychiatry. And what I mean by procedure-based psychiatry are things like electroconvulsive therapy or transcranial magnetic stimulation. Both of these are procedure-based interventions that we use to treat patients with various psychiatric disorders, and they're a big part of what some psychiatrists do on a regular basis. We may also be involved in neurosurgical cases, and the neurosurgical cases that I'm discussing specifically are ones like vagus nerve stimulator or deep brain stimulation, things that are being used to treat psychiatric conditions that require a neurosurgeon obviously to place the stimulators, and then us to probably consult on the psychiatric manifestations and do the initial evaluations, etc. So there is this whole intervention-based psychiatry that is done on a regular basis by many of these physicians. The third thing that comes to mind for me is neurological disorders. Now, as a psychiatrist, you're trained to handle a lot of the common neurological disorders, especially things like migraine disorder, for say, and 1/3 of our board exam is actually neurological testing, right? We're tested on neurological disorders. So a substantial portion of our training is based in neurology, and you do have that 2-month period as well where you're in a neurology rotation during your first year as a psychiatry resident. And in many cases, there's parts of the United States where there are no neurologists, but maybe there's a psychiatrist in the area. So then the duty of treating some of these neurological disorders falls to the psychiatrist, because that would be the next person in line capable of actually treating these disorders. The fourth thing is medical disorders, common medical disorders. So most psychiatrists would be able to treat things like hypothyroidism, hypertension, mild cases of type 2 diabetes. There's things that are definitely within our wheelhouse, so to speak, of treatment, and things that we're trained enough in medically to treat. Now, most psychiatrists are not going to treat medical disorders because most of our patients have a primary care provider. But again, like the neurological disorders, sometimes the psychiatrist is the only person to treat hypertension or hypothyroidism. And so the responsibility falls to the psychiatrist to perform that duty. The fifth and final thing I'm going to mention here is social work. And not everyone is lucky enough to have a designated social worker that can so that they can focus exclusively on the treatment of their patients. And we know that social determinants of health are extremely important and valuable, and that we need those interventions and that type of work to be done with pretty much all of the patients that we encounter. So social work can sometimes fall to the psychiatrist to be responsible for doing because there's simply no social worker to do the job. With that said, that pretty much concludes the 5 things I wanted to mention that psychiatrists do outside of prescribing medication. There's many other things I'm probably missing here. If you can think of them, drop them in the comments section. If you have questions, put them in the comments section. And please like and subscribe to the channel, and we'll continue to make videos about psychiatry.